Hello friends, this is Dr. Sonu Panwar, your microbiology faculty at DocTutorials, and today we're going to discuss up some of the relevant topics. In fact, MCQs. MCQs are easy only, and most probably, I think most of them in the test which you have given up, you have scored well only, and you should score. If you're giving up this INI CET exam, you should score good in this particular test because it is easy one. But the important is the topics we will touch and the important information. Okay. Hi Anuj. Good evening. So I'm in the live chat also. Let me say hi to everybody. So let's start up with the first question. And if you are there in the live chat, do tell up regarding the answers. What do you think? What should be the answer of it? And let's have an interactive session. Okay. Yes, please. The first one. A 40-year-old traveler consumed semi-cooked egg for the dinner. Early next morning, he developed severe vomiting and dysentery. Okay. Then his stool sample grew NLF colonies. What is NLF? Non-lactose fermenting colonies. On which media? McConkey media. And shows up alkaline slant and acid butt. So this is TSI actually, triple sugar iron 1. TSI, alkaline slant and acid butt. You write this as K by A, like this, K by A. In the TSI, you write this alkaline by acid butt. So this is there along with the plenty of H2S and gas on the TSI media that is also being observed. And what is the likely causative agents involved in causing up this particular ailment? Yes, please. Hi, Gidla. Yes. Can you tell me the answer of it? That what should be the answer of this particular question? The first question. As Devesh have told the A, Sean have told the A, Salmonella typhi. Anuj have also told the A. Okay. Now this can be A, but the answer to this particular question is what, guys? Salmonella typhimurium. What is the answer? Salmonella typhimurium. And why the answer is Salmonella typhimurium? Because of this particular. Hi, Karthik. Because of this particular stuff, which is being written in the third line, alkaline slant and acid butt. That is okay with Salmonella typhi also. But plenty of H2S is not there in the Salmonella typhi. It's very specks, very small amount of H2S is there, and there is no gas in the case of Salmonella typhi. So your question changed from this particular line. Okay. So answer to this question is what? Answer to this question is typhimurium because it is producing LLF colonies. It is having this K by A TSI slant. Plenty of H2S is also there, and there is a gas which is being there in the TSI. So answer to this particular question is Salmonella typhimurium. That is the C. C option will be the answer rather than your Salmonella typhi. Okay. So this is what is to be remembered, that gas is being written, that there is a gas, plenty of H2S. These both properties are not there of Salmonella typhi. Now you can say, sir, paratyphi A is there. Paratyphi A also can do this type of stuff. Yes, it can does. But again, the answer is in that particular one, there is no gas. Okay. So gas is absent in the paratyphi A. But here it has been written what? Gas is present in the TSI media. And what is TSI? Triple sugar iron. Yeah. So more H2S production in this particular typhimurium and gas is a feature of this. And as such also, whenever we talk about contaminated poultry bird products, three things should come in our mind. What? One is typhimurium, one is enteritis, and one is Campylobacter jejuni. I have already told that. Okay, in the lecture also, I've told that these particular three names you should remember whenever we talk about some poultry bird product contaminated. Okay, so these are the ones. Shigella soni, you already know. This is Shigella soni, and this is a LLF, late lactose fermenter, and this is the most common cause of shigellosis Shigella infection, Shigella dysentery worldwide. Okay, worldwide. So Shigella soni is that. It is a LLF. And what is LLF? It is late lactose fermenter. It is a late lactose fermenter. Okay. Another thing is, as per the INI CET stuff, Shigella soni, that is being collagen based typed. This particular question can come, that which particular Shigella is collagen based typed. The answer is Shigella soni is collagen based type, and it is a late lactose fermenter. And this particular late lactose fermenter and collagen based typing can be asked. Another is the most common cause of dysentery worldwide is Shigella soni. Okay, and here only I like to tell up, and or if I ask up also, if you can tell up in the comment section, which particular Shigella is the spoiled brat of this family. Okay, which goes against this family. Yes, please. In the comment section, if you can tell up that which particular Shigella is there, which goes against the family in everything. Yes, please tell me. Which particular one is there? Yes, I'm waiting up in the comment section. That which particular Shigella is there which goes against the Shigella family. Means if they are telling that we are catalase positive, that fellow says I'm catalase negative. If they are telling that we should ferment the mannitol, that individual says I will not ferment the mannitol. Okay, they are telling that they are gram negative organisms. Okay, gram negative bacteria, they should secrete endotoxin. That fellow says I will secrete exotoxin also. So can you tell me, guys, what is there? Yes, please. Anybody? Yeah. Tell. No. Answer is yes, please. Tell me what is the answer. I think it's not coming. Answer is Shigella flexneri. You're telling Anuj. Answer is Shigella dysentery. Okay. Shigella dysentery type 1. This particular one, Shigella dysentery type 1, is the organism which goes against the family. In what sort it goes against the family? Everybody says that they are catalase positive. This particular one is catalase negative. Everybody says that they ferment the mannitol. It says I'm a non-mannitol fermenter. Okay. Another one that everybody says that they secrete endotoxin because they are gram negative bacteria. This also secretes what? Exotoxin. So this is the one which goes in exceptions. Which one? Shigella dysentery type 1. Is it fine? So Shigella soni is that, and I hope now you must have got the answer of yours in this particular one, and the answer of yours is in this particular question, typhimurium. Okay, and I have told up the reasons. Now coming to the second one. Now coming to the second one, a blood culture of a veterinary worker. Okay, so means that fellow which handles of the animals grew up short, gram negative, coccobacilli. He suffered from chronic fever, okay, malaise, and joint pains. This particular thing is there: chronic fever, malaise, and joint pains. Tbilisi. Suppose these all things, if you know now in the question, directly you can answer up the question. Tbilisi phage typing that is being done, and what is the likely etiological agent in this particular one? And as the Anuj have told, the answer to this particular question is what, guys? And Sean Parker has also shown undulent fever. Very right, very right. Devesh is also right. The answer is B. Answer is B. The answer is Brucella species in this particular one. So, guys, regarding the brucella, what you need to know that obviously it's a zoonotic disease. It's a zoonotic disease, and this particular zoonotic disease happens to be by the various brucella species. like Brucella melitensis, Brucella abortus, Brucella suvis, Brucella canis. These are the ones. And how does this spread to the humans? By the aerosols or having what? Contaminated meat and milk of these particular animals. Yes or no? So this particular Brucella melitensis is the real culprit, which leads to undulent fever. And this undulent fever is a sort of chronic fever, which you know. And what is the triad which you observed in this undulent fever? You observe hepatosplenomegaly. Okay, hepatosplenomegaly is there. In this, night sweats, they are observed along with fever and arthralgia, joint pains. Arthralgia is there in this particular one. Arthralgia. Is it fine? So this particular characteristic triad is seen in this undulant fever along with all other features also. And one question which can come is that investigation of choice for this particular one, we say is blood culture. And in the blood culture, what should be the ratio of blood and culture fluid? That should be 1 is to 5. That should be 1 is to 5. If you take 10 ml of blood, 50 ml of glucose broth, BHI broth, that is being used in this particular one. And ratio is 1 is to 5. Is it fine? Besides this, in this blood culture bottle, you add something, and that something is what, guys? Erythritol. What is that something? This might be asked. Erythritol. Another asked question of INICT is regarding the SAT. And what is SAT, guys? Standard agglutination test. What is SAT? Standard agglutination test, which is being done for acute brucellosis. And in this acute brucellosis, SAT is there. What is SAT? Standard agglutination test. Yeah, Castaneda media. Very good, Anuj. So SAT, standard agglutination test, that is a serological test, which is termed as the best serological test for the acute brucellosis. But very few students they know that 2ME test is also there. And this is for what? This is for chronic brucellosis. This is for chronic brucellosis. Which one? 2ME. And what is 2ME? Mercaptoethanol test. 2-mercaptoethanol test is used for chronic brucellosis, and SAT is there for what? Acute brucellosis. Is it fine? And in this particular standard agglutination test, SAT, we have a phenomena also that is termed as prozone phenomenon, because brucellosis is a disease of antibody excess. Okay, so this particular prozone phenomena is shown up, and that's why we say that the first test to the SAT might come negative, second will come positive when you do what? When you do the dilution. So dilution is done to remove the prozone phenomena. To remove prozone phenomena. So this is already asked question. Definitely can come to you. The extra question which I am telling up is 2ME, 2-mercaptoethanol is being used for chronic brucellosis. Okay, this might come. The drug of choice you already know, that is the doxy. And this doxy is along with rifampicin, can be used, or with streptomycin. So this might also be asked in the exam, that along with the doxy, which other drug that is also being used? So answer is rifampicin and streptomycin. Is it fine? So these all are important stuff regarding the brucellosis, which you should know. Another thing is those particular names of the card test, that is Rose Bengal card test, milk ring test, whey agglutination test. Those all tests which are there, they all are being used for what? They all are being used for the milk contaminated with brucella. Milk contaminated with brucella. Is it fine? So this is the way to approach up these particular types of stuff, and definitely the question might come over the brucella. Okay, and the important point which I've told up is regarding the 2ME, that is 2-mercaptoethanol test. 2-mercaptoethanol test. Okay, so now coming to the third one. Now coming to the third one, a patient suspected of endocarditis. Okay, a patient suspected of what? Endocarditis, guys. This particular one grew up what? It grew up gram negative bacilli. Okay, what did it grew up? It drew up gram-negative bacilli on the blood culture. On the blood culture, they were oxidase positive, catalase positive, and produce what? Bluish green pigmented colonies on the blood agar. What does it produce? Bluish green pigmented colonies on the blood agar. Which organism likely to associate with this particular stuff? So can you tell me what is the answer in the comment one of this particular? Tell me. Yes, please. What is the answer of this particular one? Pseudomonas. Pseudomonas, you have got the hint from what? This bluish green colonies on the blood agar. Very right. So answer is Pseudomonas aeruginosa. No doubt in that. And the important thing regarding Pseudomonas aeruginosa, yes, very right. You have told Devish. The pigment is pyocyanin. The pigment which you are talking is what, guys? Pyocyanin, the most common pigment. Another one common is pyoverdin, pyorubrin, and pyomelanin. Important is what is the culture media for this, and the culture media is citrimide agar. Now, citrimide is a disinfectant. So this question can also come. Name a organism. Name an organism which can grow in disinfectant agar. The answer is Pseudomonas. Okay, Pseudomonas aeruginosa is the most common species, which is of Pseudomonas. Other than that, important is that this is oxidase and catalase both positive. And why this particular statement is important, that this is oxidase and catalase both positive? Oxidase positivity, oxidase positivity differentiated from the full Enterobacteriaceae family. Enterobacteriaceae family full is what? Oxidase negative, and this is oxidase positive. A simple oxidase test will easily rule out this particular Enterobacteriaceae family from the, like, what do you say, in the diagnosis. Is it fine? So this you need to know. Other thing is, what is oxidase test? Oxidase test is that you have a white color filter paper or white color disc in which you touch, and immediately that white color changes to blue within 10 seconds. That is termed as oxidase positivity. That is termed as what, guys? Oxidase positivity. So this also he needs to remember, that this is oxidase positivity. Other important questions which likely might come in this particular question, like according to the Pseudomonas, what it can come, that it leads to malignant otitis externa, which is a frequently asked question, which is not a malignancy, fulminant infection, in which even cranial nerves are involved. That particular stuff. Other than that, vancomycin and ceftriaxone, they are not anti-pseudomonas. And up till now, against which particular drug we don't have any resistance? That is polymyxin B. So that is also one of the answers which you need to remember. Okay. Cardiobacterium hominis. This name, if comes up, what comes in your mind? Cardiobacterium hominis. Yeah, very good. Ectyma gangrenosum is being done by this. And Kartika, most common cause of burn wound infections is not Pseudomonas. It is Staph aureus. But yes, it associates with burn wound infections. No doubt in that. Okay. Cardiobacterium hominis. Yes. Can you tell me in the comment section? Cardiobacterium hominis. What does it do? Cardiobacterium hominis. Yes, please. Cardiobacterium hominis. Cardiobacterium hominis associates with, yes, please. Cardiobacterium hominis associates with culture negative endocarditis. If you remember of culture negative endocarditis. Okay. Which other is there which associates with culture negative endocarditis? So, guys, one is Coxiella burnetii, okay, which associates with Q fever, also does this culture negative endocarditis. And another one is this particular Cardiobacterium hominis, which is a part of Hassek group. And one is Trophariма whippley. Tropharima whippley. And this particular Tropharima whippley is there which associates with Whipple's disease as well as culture negative endocarditis. Culture negative endocarditis. Okay. So three names you need to know which does the culture negative endocarditis, and definitely it can come as a question in INI CET. Hasek group, Coxella burnetii, and Tropharema whipplei. These three you might be seeing up in the exam. Okay, they associate with endocarditis. And a new question which can be there is that in the Pseudomonas aeruginosa, which particular valves they are mostly involved? The answer is left-sided valve. Left-sided valve endocarditis is most commonly done in the IV drug abusers. In the IV drug abusers, in the IV drug abusers, left-sided valve endocarditis. That is being done by Enterococcus along with this particular Pseudomonas. Along with this particular Pseudomonas. Is it fine? So remember this particular question might come that yes, it associates with what? IV drug abuser, left-sided valve endocarditis. Right-sided is staph, overall staph aureus. Okay, overall also staph aureus. So this is there in this particular question. Let's come to the next. Okay, a 65-year-old man in the US attended a camp in the forest area. Soon he developed cough, fever, and fatigue. His blood sample grew fungus. His blood sample grew what? Fungus. And the sputum shows plenty of spherules. Which of the following is likely to associate with this particular case? Yes, please. Tell me. Tell me in the comment section what should be the answer of yours for this. Yes, please. What should be the answer of yours in this particular one? Tell me. I'm waiting. As you have told, the answer A. Histoplasma capsulatum. Huh? Spherules are seen in the histoplasmosis. Who said spherules are seen in the histoplasmosis? Guys, spherules are not seen in the histoplasmosis. In the histoplasma capsulatum, there was a tuberculate macroconidia. If you remember, why everybody have done this question wrong? Answer is coccidioides immitis. Answer in this particular question is what, guys? Coccidioides immitis, not histoplasma capsulatum. Okay, why? Because plenteous spherules, if you forget upon, what was there? The plenteous spherule. Roshna have told, right? Because if you remember that this coccidioides immitis leads to which particular disease? Coccidioidomycosis, which is a dimorphic fungus. Coccidioides immitis. Okay. And they are what? They show up two things. One is mold form and one is yeast form. Okay, one is mold form and one is yeast form. The mold form is what? Arthroconidal arrangement. Arthroconidal arrangement. And what is the arthroconidal arrangement? The arthroconidal arrangement is like this. Okay, this is termed as arthroconidal arrangement. Okay, and the yeast form of this is having a spherule. Okay, having a spherule with endospores. Having a spherule with endospores. That is the characteristic of this particular coccidioidomycosis, which leads to which particular disease, guys? Coccidioidomycosis. Is it fine? Is it now okay? So remember this particular fact that in this, the answer is coccidioidomycosis, US, and in the NEET PG, what came that this also associates with Sanjaquin Valley fever and desert rheumatism. San Joaquin Valley fever and desert rheumatism. Okay, but Kartika, there is no option which is telling up Candida imitis is no species of Candida. Second option is Candida albicans. C is the answer here. Coccidioides imitis. Okay, so this is what is there, and San Joaquin Valley fever and desert rheumatism were asked in the NEET PG, and basically they are the places where this fever is there, and some arid region it leads to joint pains. That is termed as desert rheumatism. Okay, now come to this a easy one. A 58-year-old female presented with chronic watery diarrhea. She was seropositive for HIV. Her stool microscopy showed acid-fast oocyst measuring 5 microns in diameter. What is the likely etiological agent? Yes, please. What is the answer? Give in the comment. What is the answer of this particular question? 58-year-old female. Very good, Ajay. Anuj, rheumatism. That is already done. Now I come to this. What is the answer of this particular one? A 58-year-old female. Answer is A, as Kartika have told, Cryptosporidium pavum, which have the size of 4 to 6 micron oocyst. Okay, which have the size of 4 to 6 micron oocyst, and that is found to be acid fast. Now, here the question can come that this acid fastness of these oocysts is by which particular method? The answer is Kinyon's method of staining. Which particular staining is done here, guys? Kinyon's method of staining. So Kinyon's method of staining, that is there in this particular one. And what is Kinyon's method of staining? Kinyon's method of staining is cold method of staining. It is termed as what? Cold method of staining. Okay, in this you do not heat. Intermittent heating is not done. It is like concentration of carbonyl fission is increased. And as it is written 5 micron, it lands between 4 to 6. The answer is cryptosporidium pavum. And this cryptosporidium pavum is the most common cause of watery diarrhea in the HIV positive. Okay. This is the most common cause of the watery diarrhea in the HIV positive. Is it fine? So as you are telling now in the comment section, so remember all these particular important points regarding the this particular one, HIV, along with this chronic watery diarrhea. Now, Isospora belli is the one which have the new name Cystoisospora belli, and it is having the highest size 23 to 36 micron of the oocyst in this particular one. Okay, in this particular one. And Valentinium coli, this might be asked, it is a ciliate, and this particular ciliate is the one which have micro and macronucleus. This question might be coming. The name a ciliate, which have two types of nuclei. So one is micro, guys, and one is macro. Micro and macronuclei, these are there in this particular one. Okay. Now, everybody knows about Cryptosporidium pavum, Cyclospora, okay, and this particular Cystoisospora belli. Everybody knows about them. But there is one more which can be asked in the exam, that is Microsporidium, Microsporidium binusi. Okay, this Microsporidium binusi is also having a acid fast oocyst, and the size of them varies between 1 to 4 micron, and they are also acid fast, 1 to 4 micron. Okay, but obviously it is less common than these three, but you need to know it might come as an option that is it there in the HIV positive also. Yes, this also is there. Which one? Microsporidium binusi. And you know these particular ones which we're talking about, these all are what? These all are coccidian parasites. These all are protozoa. These all are protozoa coccidian parasites. Is it fine, guys? So remember this particular also. And the drug of choice for cryptosporidium pavum, nitazoxanide. What is the drug of choice? Nitazoxanide. Now coming to the next one. Okay. Now coming to the Next question, that is, a 12-year-old girl presented with diarrhea few days back and features of ascending paralysis is observed. Okay, the hanging drop of the stool sample shows up darting motility. What is the likely causative organism in this particular case? So, guys, tell me the answer of this particular one, that the hanging drop is showing up the darting motility, and what is the likely causative organism in this particular one? Yes, please tell me what should be the answer. And as Shweta have told, the answer is D. No doubt in that, and you're right. This is Campylobacter jejuni. This is Campylobacter jejuni, and Campylobacter jejuni is the one which associates with which particular ailment, guys, which we are talking here? GBS, Guillain-Barré syndrome, which is which side of paralysis? Ascending paralysis. Ascending paralysis, and the immune system acts against the peripheral nerves and leads to this tingling sensations and all. Okay, yeah, nitazoxanide, nitazoxanide, Anuj, yeah. So Campylobacter jejuni does this GBS, Guillain-Barré syndrome, ascending paralysis, and Campylobacter jejuni O19. If somebody says na, which one mostly correlates? Somatic antigen O19. You need to know this particular special information, which I'm telling here, that this one mostly associates with GBS. Okay. Over all other serotypes also does, but this is like special one, which associates with causing of what? Guillain-Barré syndrome. Is it fine? So this is also to be remembered. Along with that, you know that GBS is also associated with which particular infection? Mycoplasma pneumoniae. Mycoplasma pneumoniae. And if we talk about the viral infections, Zika. Zika virus strongly associates with GBS, and even CMV infection, cytomegalovirus infection also associates with this. Yeah, Kartika, Vibrio cholerae have, but you should know this also, that Campylobacter jejuni is also having a darting motility. Okay, so nothing that sort happens in the Vibrio cholerae, GBS and all. GBS strongly associates with what? Campylobacter jejuni. Is it fine? So answer to this question is what? D, guys. Campylobacter jejuni. And if some ask you that Campylobacter jejuni, what is the shape of it? It's gulving shape. And which type of culture media is used? Charcoal based culture media like Skiro, Buzzlers. These all are used for this particular Campylobacter jejuni. Is it fine? Now coming to the next. Tell about this question. All the following are characteristic features of classical biotype of Vibrio cholerae except. Okay. You know, na guys, that we have oven vibrios. We have which vibrios? Oven vibrios. And these oven vibrios, they are of two types. One is classical and one is Eltor. One is classical and one is Eltor. So both have oven vibrios. So they agglutinate with what? They agglutinate with oven antisera because they have oven antigen. That's why they agglutinate with oven antisera. How to differentiate between them? I told you, classical and Alto are they easily differentiated with the help of two things: polymyxin B sensitivity and Mukherjee Phage 4. That testing, phage, whatever you call it. Okay, so two tests which I told up is polymyxin sensitivity. Okay, polymyxin sensitivity one, and the other one is Mukherjee Phage 4. Mukherjee Phage 4 testing. Okay, so both this are positive in the case of classical, and both are negative in the case of Altor. Okay, both are negative in the case of Altor means polymyxin resistant is Altor, and Mukherjee Phage 4 does not eat which growth? Altor. It eats up the growth of classical. Very right. Okay, but remember Mukherjee Phage 5. This is also there, and it is negative here, and it is positive in the Altor. It is positive in the Altor. So as Anuj have told, the answer as B, And that particular one is perfectly right. The answer is sensitivity to the Ph5 is not there in this particular one. So there is no positive heme agglutination with chick RBCs, one thing. So means what? This particular property, positive heme agglutination with chick RBC, is a feature of LTOR. Okay, here in the case of classical, there is no positive heme agglutination, 1 point. Sensitivity to the Ph5, that is seen in LTOR. That's why this is the answer. Sensitivity to the Ph4, I already told her. Susceptibility to the polymyxin B, I already told her. So answer is B. And I suppose everybody agrees up. Regarding this, the important one which I think can be coming is the cholera toxin. The cholera toxin, Vibrio cholera, attaches to the zona occludens or tight junctions and release of the cholera toxin. Cholera toxin is having A and B. B binds to GM1 ganglioside receptors, and A does what, guys? ADP ribosylation of GTP. And which particular stimulatory protein is involved? G stimulatory protein. This might be asked. That in the Vibrio cholerae, which particular protein is involved? G stimulatory protein, and that leads to increase in annihilate cyclase activity, which thereby increase in cyclic AMP, and that leads to intracellular water coming into lumen, which is having which type of diarrhea? It is having rice watery stool, and rice watery stools mimics up which particular metal poisoning, guys? Arsenic metal poisoning. It mimics up what? Arsenic metal poisoning. So this particular question might be there in your exam. Another thing here only I like to tell you, the question which they are asking again and again is regarding the Vibrio parahemolyticus. Vibrio parahemolyticus is 7% halophilic. It is 7% halophilic, associates with seafood poisoning, associates with seafood poisoning, and mostly this poisoning happens after eating up oysters, and it can happen after having the crab also, obviously contaminated one. And after that, the question which might be there in the exam is Kanagawa phenomenon. Kanagawa phenomenon on which particular agar? Vagatsuma agar. And what is this Kanagawa phenomenon, guys? This Kanagawa phenomenon is enhanced beta hemolysis on Vagatsuma agar. And Vagatsuma agar is what? High salt content agar. So this is a hard question to be told. And this parahemolytic is found to be capsulated as well as bipolar stained. And Kartika, you are right. Kanagawa is enhanced beta hemolysis on which particular media? On Vagatsuma agar. Okay, 7% halophilic. And if somebody asks you that which one is the maximum halophilic here, the maximum halophilic is the maximum halophilic is Vibrio L genolyticus. Vibrio L genolyticus, and this particular question was also being asked, L genolyticus, in the exam. It is 10% halophilic. It is 10% halophilic, and there is one which is 8% Vibrio vulnificus, which associates with what? Coral cut wound infections. Coral cut wound infections. Very right. Shellfish or oysters. These associates with this seafood poisoning. Oysters or shellfish. Even crabs also. The crustaceans basically in this particular one. Okay. Now, coming to this, a 28-year-old male was brought to the hospital in a state of altered mental status. He soon progressed to the coma and respiratory paralysis. The family members informed that he had consumed some preserved meat the previous day. The smear from the suspected meat shows up gram positive, sporing bacilli. What is the likely agent associated with this? Yes, please, tell me answer of this particular question. Tell me the answer of this particular question. A 28-year-old male brought to the hospital in a state of altered mental status, progressed to coma even, and can develop up respiratory paralysis. The family members informed that he had consumed preserved meat the previous day. The smear from the suspected one showed up gram positive sporing bacilli. So, guys, if you know this only, na, that this is a gram positive sporing bacilli, your question will be done. Tell me what we are talking about. The answer to this question, as the Sean Parker have told, is Clostridium botulinum. Clostridium botulinum is there, and this is a sort of a canned food poisoning which have happened up in this particular one. Progress to coma, respiratory paralysis. Action is anticholinergic. Use up certain snare proteins, and these snare proteins names definitely can be asked. That the botulinum toxin used up which particular snare proteins. So, guys, I already told up synaptobravin. Okay, synaptobravin, syntaxin, and SNAP 25. These names you should know of the snare proteins which are used by which particular toxin? BT toxin. No, 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 no. Anuj, inhibition of GABA and glycine is there in the Clostridium tetani. And here it is this that they use of these snare proteins to have which action? Decrease in the acetylcholine levels. Okay, decrease in the acetylcholine levels at various junctions. This is asked. How to remember? A brave boy or a girl have ascended where on a syntax and taken up how many snaps? 25 snaps after having BT. BT is bottle. Okay. So this is what is there. So answer to this question is Clostridium botulinum, which is gram-positive bacteria, and it is sporing also. It produces spores, bulging spores. Okay. Enterotoxigenic E. coli, if we talk about, it leads to traveler's diarrhea. This leads to what, guys? Traveler's diarrhea. And the traveler's diarrhea, everybody knows the most common cause of traveler's diarrhea is enterotoxigenic E. coli. This particular one. Okay. But few know that which particular antigen is involved up in this, and that is termed as CFA. And what is CFA? Colonization factor antigen. Which particular antigen is involved up in the pathogenesis of this? Colonization factor antigen, and this might be seeing up in the exam. Colonization factor antigen. Okay. Colonization factor antigen is used in the enterotoxigenic E. coli stuff. Fine. Campylobacter jejuni we already have done. It is associated contaminated poultry bird products and does the inflammatory diarrhea. And the important is fecal leukocytes and gulving or gulving shaped bacteria. Important that in the culture media, what should be the temperature of incubation? 42 degrees centigrade. What should be that? 42-degree centigrade. Very right. Now talking about the Yersinia enterocolitica. If this particular question comes up regarding Yersinia enterocolitica, you should know that it mimics of this appendicitis, and that's why it is termed as what? Pseudo appendicitis. This associates with what, guys? Pseudo appendicitis. One thing. And also termed as mesenteric adenitis. All this is does terminal ileitis, Yersinia enterocolitica. Important, which can come in the exam is it shows differential motility based on temperature. Differential motility based on temperature. That is being shown up by this Yersinia enterocolitica. Yersinia enterocolitica. Okay, and what is differential motility? At 25, this particular one is motile, and at 37, this one is non-motile. Exactly similar is the property of listeria. Exactly similar is the property of what, guys? Listeria. Okay. So this also needs to be remembered in this. The answer to this particular question is what? Clostridium botulinum. And important in canned food poisoning, there is no diarrhea, there is constipation because the action is anticholinergic, and these snare proteins also need to be remembered. Okay. So now coming to the next one. A 53-year-old man on long-term antibiotics, okay, developed diarrhea. His stool examination showed the presence of leukocytes and was positive for toxin. What is the most likely etiological agent in this particular one? Okay, most likely etiological agent in this particular one. So, can you tell me, guys, what should be the answer of this particular question? Campylobacter jejuni is the organism. Is it Candida albicans? Is it Clostridium difficile? Or is it enterotoxigenic E. coli? And Sean Parker have told Clostridium difficile. Yes. Any other? Okay. Everybody is telling Clostridium difficile. First of all, you should know what is the new name. The new name is Clostridium difficile. Okay. The new name of this is Clostridium difficile, which associated with AAD or CDAD. CDAD is what? Clostridium difficile associated diarrhea, and this is antibiotic associated diarrhea. First thing. Then you should know that which antibiotic is associated with this. The antibiotics which are there is cephalosporins, third generation cephalosporins, ampicillin, clindamycin, aminoglycosides, sulfonamides. Okay, what else? Ciprofloxacin and all. That is these particular ones. They are the ones, if they are taken up for a very long time, they kill your normal flora. E. coli is gone. And who is sitting in the gut for that day only? Clostridium difficile. It attaches, does irritation, leads to watery diarrhea. Okay, leads to watery diarrhea. Sometimes blood can come. This also came as a INI CET question, that in the case of antibiotic associated diarrhea, does blood can also come sometimes? Yes, slight bit blood can come. And if you ignore this, then what produces a pseudomembranous colitis, ulcer formation. Okay, and that is what is termed as pseudomembranous colitis. Okay, that is what is termed as pseudomembranous colitis. What is the drug of choice for pseudomembranous colitis? Nowadays, it is fidaxomicin. Okay, fidaxomicin, that is the drug of choice for this particular pseudomembranous colitis. Important is the question which likely to be coming is that in this you go for ELISA for the toxin, and this toxin is a combination of toxin A and toxin B. Toxin A is enterotoxin, toxin B is cytotoxin. So one is antero and one is cyto. This combination is being demonstrated by which particular test? ELISA. Along with that, GDH, antigen card test. GDH, antigen card test. And what is GDH, guys? Glutamate dehydrogenase. Glutamate dehydrogenase antigen card test. This combination is the best answer for the investigation of choice if somebody asks you for the Clostridium difficile associated diarrhea. Okay, so this is important. It is, this combination is better than even the PCR, and this might be asked in the INI CET exam also. And what is GDH, guys? Again, I'm telling up, glutamate dehydrogenase antigen detection. Glutamate dehydrogenase antigen detection. Okay, so whenever you hear about the antibiotics and toxin, think for Clostridium difficile, which is having this antero plus cyto combination. Is it fine, guys? Now come to the next one. Another easy one. A 8-year-old school-going child presents with diarrhea, which is said to have for the past 3 days. Stools were greasy, bulky, foul smelling, sufficient hints. Fat globules were there, observed on the stool examination. He gave a history of consuming unfiltered water when he was out for the camping and hiking. This might be all there in the exam, in the case scenario. What is the likely causative agent for this particular one? Yes, please tell me the answer in the comment section. What is the answer, guys? Tell me. Tell. What is the answer? B. You are telling B, and B is correct. Giardia lamblia. Okay. This particular Giardia lamblia, what is the infective form? The infective form is binucleate cyst. Okay. It is being said that 10 cyst can also do the infection of Giardia lamblia. Another is where they exist. Excistation happens in duodenum. Excistation happens in duodenum. And for the Giardia lamblia, you do a string test in which you try to demonstrate the trophozoites of it. And the trophozoites of this is what? The trophozoites of this are monkey face, tennis racket. Yes or no? Which type of trophozoites are observed? Tennis racket shaped or monkey face having how many flagella? Four pairs of flagella. And which motility? Falling leaf-like motility. How to remember? Giardia. Giardia, Giardia. So that particular one also is there regarding it. And yes, and all these particular ones is due to malabsorption, because it does malabsorption, and that leads to what? Greasy stools. Steatorrhea happens in this particular condition. And those which have selective IgA deficiency and CVID, they struggle with giardia. And what is the drug of choice? Metronidazole. The drug of choice is what, guys? Metronidazole. Okay, very good. Dr. Nirdai have told up falling leaf-like motility. Good man, good. The catch point is greasy, foul smelling. Okay, Anuj, you got the hint from this. Fine. So, guys, answer is giardia lamblia, no doubt in that. And the drug of choice is what? The drug of choice is metronidazole. Metronidazole. Is it fine? And infective form, everybody should know. An infective form is binucleate cyst. Important is that the trophozoite as well as the cyst, what they have the exostyle in between, and that exostyle gives them a stylish stuff. Okay, so this is regarding the giardia. Now, guys, this a 1.5 year old non-vaccinated child presented with signs of meningitis. The CSF showed pleomorphic gram-negative bacilli. What does it show? Gram-negative bacilli on blood agar. The organism showed up enhanced growth in the presence of X and V factors. X and V, they come in the form of disc. Okay. So it shows a enhanced growth in the presence of what? X and V. What likely organism we are talking about? Yes, please. Kartika, you have told up D. Yes. Any other? Very good, guys. The answer is D. And the hint is pleomorphic, gram negative. It changes shape. It's a cocobacillus. It is a cocobacillus, first of all. One important thing. It's a cocobacillus. Another takeaway from this question is that it loves to grow on chocolate agar. And what is chocolate agar, guys? In the blood agar, if you add up X and V, that is chocolate. Okay, it loves to grow on chocolate agar. So this is also a hint that in the presence of this X and V, Hemin and NAD, the growth is good. And definitely, as you're telling up in the comment section, it shows up satellitism. What does it show? Satellitism. Another important hint regarding this. And the extra stuff which I tell you here is type small b, PRP, polyribitol phosphate, phosphoribosyl phosphate. This is responsible for what? This is responsible for the capsule. Okay, this is there in the capsule. This particular thing, type small b PRP, is in the capsule, and from this capsule, we make which vaccine, guys? Hip vaccine. So, guys, remember, pneumococcal vaccine is also from capsule, meningococcal vaccine also from this, and Haemophilus influenzae type B is also a capsular one. Okay, so you can use any cephalosporin here, not exactly cefotaxime and all. Cefotaxime works good, but others also they go good. They does good in this. So not exactly cefotaxime is the treatment. You can't say like this. Okay. So this particular one is a non-vaccinated fellow. First of all, you should know about the vaccine. The HIV vaccine is a very good vaccine, mostly prepared from this type small b PRP. And what is PRP? Phosphoribosyl phosphate. That is there. Okay. Phosphoribosyl phosphate or polyribitol phosphate. That is also there. Okay, guys. And important is the capsulated strains of Haemophilus influenzae leads to meningitis, epiglottitis, thumb sign one. Okay. Then endocarditis, all these particular ones, they all are being done by what? Capsulated one. Because non-capsulated, what they do? They do simple infections like LRTI, otitis media, sinusitis, these all. Important takeaway is X and V. Around X and V, these particular ones, they show a enhanced growth because they love chocolate. And what is chocolate? Human and land. Okay. Now, coming to this, a regular swimmer was admitted with diminished vision and neck stiffness. Examination found she was found to have a keratitis and meningitis. Keratitis and meningitis. She gave a history of using semi soft contact lenses. A CSF culture on the axonic media. Axonic media is one which allows only one growth. That shows the microbial growth. And here we use non-nutrient agar with E. coli. That can also come. That's what you use here. Non-nutrient agar with E. coli. That is termed as exenic stuff. Which organism is commonly associated with this condition? Can you tell me, guys, what is the answer in this particular question? Is it Streptococcus pneumoniae? Is it MTB? Is it Acanthamoeba? Or is it Toxoplasma gondii? And as usual, you are right, guys. The answer is Acanthamoeba. Acanthamoeba species. Which species? That's also, if you remember, it's good for the INI CET. The answer is Culbertsoni. Okay. Acanthamoeba culbertsoni is the one which associates with this particular contact lens keratitis. And this contact lens keratitis, which is by the thorn-like pseudopodias of this particular trophozoite of this, that is also one of the questions. That thorn-like pseudopodia are there in this? Yes, they are there in this. And this particular contact lens keratitis through the optic route, it can go to the brain and it can does what, guys? Granulomatous, encephalitis. Okay, so this particular one associates with causing a what? Granulomatous encephalitis. Which one? Acanthamoeba. By this route, by the eye route, or through the aerosol route also, it can do the same stuff by going to the lungs, from the lungs, blood, and from the blood goes to the brain. And these does what? Granulomatous encephalitis. Is it fine? So this is there in this, and important, the trophozoite of it is having a thorn-like pseudopodias. Thorns. You can remember like this. Those thorns have gone into the eyes and does what? Keratitis. This question came, again can come. Axonic media, non-nutrient agar with E. coli. Non-nutrient agar with E. coli is used to grow up acanthamoeba. Other ones are Naegleria fowleri, which is a free labor amoeba, leads to what? PAM, primary amoebic meningoencephalitis, also termed as brain-eating amoeba. And the third one is Balamuthia. That particular one also associates with what? Granulomatous encephalitis. And there is one more, Sapnia, which associates with granulomatous encephalitis. Exactly. So this is what is their answer. Answer is A. And I have told up all the possible questions in and around this particular one. Now coming to this, another easy one. Let's see how much you answer. A 56-year-old HIV seropositive patient presents with loss of appetite. The CSF grew acid-fast bacilli with trehalose 6,6 dimycolate, named organism associated with this particular disease. Yes, please, guys, tell me the answer of this particular question. Let's see what you answer in this particular one. The catching hint is regarding the trehalose 6,6 dimycolate. Trehalose 6,6 dimycolate. Manisha told Kansasi. Okay. Any other? What is the answer of this particular question, guys? Please tell. B. Sean Parker have told B. Mycobacterium TB. Now the question to Sean Parker of mine is why the answer is not A? Why the answer is not M? Why the answer is not Kansasi? Because they can also happen in HIV positive. Even MAC happens more. MAC like a CD4 counter less than 50. That is also there. And I'm telling up regarding this Trehalose 6,6 dimycolate. What is your answer regarding this? Tell me. Yes, please. The answer to this question is TB only, guys. You're right. This is MTB. Okay. And which particular atypical mycobacteria mimics the MTB in lung involvement? That is Kansasi, which you're telling, which is the photochromogen. Okay. So M avium intracellular is also acid fast, Sean. That is also acid fast. Nowhere it is written it is 20% acid fast. Trehalose 6,6 diamycolate. Let me tell you, and this might come in the exam also, extra point. The other name of cod factor. Other name of cod factor is trehalose 6,6 dimycolate. That is what is the other name of this particular one. Trehalose 6,6 dimycolate. Is it fine? So cod factor and lipoarbinomenin, if you remember up, they were there in the Mycobacterium TB. Okay, they were the virulence factors of this particular one, lipoarbinomenin and the cod factor. So answer to this question is no doubt what? MTB. You are right in that. But this extra point, you must not be knowing up that the other name of this is what? Trehalose 6,6 dimycolate, and that is a cod factor, and cod factor is a virulence factor. And because of these two, lipoalbumin and cod factor, the MTB prevents its killing by preventing what? Prevent the phagolysosomal fusion. It prevent the phagolysosomal fusion. Okay, what it prevents? It prevents the phagolysosomal fusion. Okay, yeah, yeah. Oh, name, very interesting name you have, Nirdehi Billah. And this is the lamb assay. Yes, very right. In the urine, this was there, lipoarbinomenin, and they were the virulence factors, and they prevent the phagolysable fusion. They will prevent the intracellular killing of Mycobacterium TB. So answer here is this. MAC, you already know, it happens at 3D4 count or less than 50. This particular infection of MAC and Kansisi mimics MTB in lung involvement, and it is an atypical mycobacteria. Atypical mycobacteria, which is a photochromogen, grows in the light and produce pigments. And MAC, the MAC is non-chromogen. The MAC is non-chromogen. It does not produce any sort of pigment. Okay. Now coming to the next, a child with trigeminal neuralgia. Okay, and the vascular painful ulcer around the mouth was admitted to the hospital. CSF sample collected and inoculated on the cell culture showed syncytia or synectia formation or synectium production and ballooning. What is the likely organism associated with this particular condition? So, can you tell me? Yes, please. What is the answer of this particular one? A child with trigeminal neuralgia, vascular painful ulcer around the mouth, ballooning is there, synectium production is there. Okay, so this is, I think, self-sufficiently answered. Manisha told D, and Manisha is right also in some sense. It might be D also, but the other ones like vascular painful ulcer around the mouth, trigeminal neuralgia, ballooning, synectium production is there in varicella zoster also. That is true. They mostly relates with herpes, guys. So answer to this particular question is what, guys? Herpes, not the varicella zoster. Varicella zoster is one of the, like, in the close run. This was there for this answer, but the answer here is herpes. Okay, trigeminal neuralgia. It resides in trigeminal ganglion, na herpes, and this particular one, that is vascular painful ulcer on the mouth. It is not observed in this particular. And synectia production and ballooning, that is a feature of mainly the HSV1, HSV2. It might be seen in HSV3. Okay. So answer, yes, you're right. Like, you're right. This particular one, that it might be D also. It going in a close run, but the better answer will be chosen is herpes here, because most of the conditions like supporting up the herpes here. So answer of choice will be herpes. Okay, but yes, you are right. It can be varicella zoster also. Now, you know that these fellows are alpha. Just now we have done, na? These all are what? Alpha Windy members. And alpha Windy members are what, guys? HSV1, HSV2, and HHV3. Human herpes virus 3, chickenpox 1, varicella zoster. And this particular smear is being done for all of them. That is coming again and again. For which fellows? Alpha Windy members. Zang smear. And in the zinc smear, you see which particular cells? You see the zinc cells. And what is zinc cells? The synectium. Okay, multinucleated giant cells. Multinucleated giant cells. That is what is termed as zinc cells. Is it fine? This is also there in this. Okay. Now tell about this. A 20-year-old presented with projectile vomiting, headache, and fever. The one thing is for sure that this is meningitis. Hospitalized and diagnosed with meningitis having purpuric lesions over the limbs. The gram stain of the CSF showed intracellular and extracellular gram-negative diplococci. Which organism is responsible? Yes, please tell me. What is the answer of this particular one? What is the answer of yours in this particular one? A. And very right. Everybody's right here. The answer is meningococci, Neisseria meningitidis. That is what is the answer. It is a gram-negative diplococci. Diplococci are those which are in pairs. What is the shape of this? It is lens shape. It ferments which particular sugar, guys? It ferments glucose and maltose both. It ferments glucose and maltose both. This is important, which is termed as R-cut, associates with Waterhouse Friderichsen syndrome. Very right, that will have told. And this particular lesions over the limbs, they show that this particular individual have gone into what? Purpura fulminans. And purpura fulminans is having these purpurico-petechial lesions along with the shock-like condition. That is Waterhouse Friderichsen syndrome. Okay. So if they're talking about fever, headache, neck rigidity, projectile vomiting, along with rash, they're talking about meningo. Okay. Important regarding pyogenic meningitis is bacterial meningitis. The CSF glucose is less, CSF proteins they are increased, and neutrophils are very much increased. Okay. So that also is there in the pyogenic meningitis. So answer is very clear. The answer is meningo. Now come to this. A 55-year-old farmer, a known asthma patient, admitted for evaluation of chronic productive cough. On admission, he had high-grade fever. Chest X-ray showed up lobular infiltrates, means in the law of the infiltrates. On the gram stain, the sputum showed numerous eosinophils and fungal filaments or elements, we say them, with septate hyphae at 45-degree angle branching. So this is a sufficient hint which definitely will be telling you the answer. And the answer is what, guys? Name the organism associated with this particular condition out of these four options. Can you tell me? What is the answer? The answer is very right. Again, everybody have told wonderfully well. Good. The answer is Aspergillus fumigatus. Aspergillus fumigatus is the answer. And this Aspergillus fumigatus associates with which all ailments, guys? This one associates with aspergilloma. This one associates with AVPA, allergic bronchopulmonary aspergillosis. This one associates with oculomycosis, okay, or automycosis. These all things are being done, okay. And what you observe in this type of hyphae, and this hyphae can be seen on the 10% QH angle of 45-degree or 60-degree with septate hyphae, with septate hyphae, and wide angled aseptate, that is mucor, that is mucor. So remember aspergillus, the last alphabet of aspergillus is S, septate. Manisha, you're right. In this, one particular ailment is there which is termed as invasive aspergillosis, for which you do which particular testing? Galactomannan testing. And this galactomannan testing was being asked up in the INI CET exam. Okay, so galactomannan testing is there in this invasive aspergillosis. Yes or no? And another one which is there is beta 1,3 glucan testing. Beta 1,3 glucan testing along with galactomannan testing. Is it fine? Okay. So this also needs to remember beta 1,3 glucan testing is done for what? The answer is CAP. And what is that cap? Invasive candidiasis, invasive aspergillosis, and pneumocystis zeroaceae. Another favorite question of INI CET fellows is this: it is not done for mucor, it is not done for crypto, it is done for cap. And what is cap? Candida, aspergillosis, and pneumocystis zeroaceae. And which candida? Invasive candidiasis, invasive aspergillosis, and pneumocystis zeroaceae. Okay. And the collectivity testing is done for aspergillosis. This was asked in the INI CET exam. And what is the drug of choice? This is definitely can be asked: voriconazole. Voriconazole for this particular one. Voriconazole is used, the drug of choice for invasive aspergillosis. Okay, invasive aspergillosis. And do you remember this now? So for what it is being done, not for which is not being done. So remember, like this cap, for this it is done, and rest of all you do not do it. Simple. Okay. So that is there in this. Another added point which I can tell you is in the Aspergillus fumigatus, it is greenish colonies which are observed on the SDA media. It is the greenish colonies which are observed on the SDA media. Okay. Important is this, that greenish colonies are there in SDA. In the case of fumigators, in the Niger it is black, and in the flavus it is yellow. And Aspergillus flavus are also associated with what? Hepatocellular carcinoma. Okay, because it secretes of which toxin? Aflatoxin. It secretes of which toxin? Aflatoxin. Okay, and if we talk about mucor here itself, the mucor colonies on SDA, if somebody asks up, answer is fumigators. Okay, mucor colonies on SDA, if somebody asks up, is what? Cotton woolly. Okay, this question came. Cotton woolly colonies is a feature of which particular fungus? Answer is mucor. Okay, salt and pepper like colonies, rhizopus. And what they have? They have wide angled hyphae. Okay, 120 or 90 degree aseptate. They are these particular fellows, mucor, rhizopus, they are known as lid lifters. What do you call them as? Lid lifters. And they're ribbon like. They look like a ribbon. Okay, they look like a ribbon. So all these particular ones you should know regarding what? Regarding the mucor. And drug of choice for mucormycosis, which can happen in those which are on prolonged steroids in the COVID-19, DM, diabetes, diabetic ketoacidosis, those frequent blood transfusions, chronic dialysis, these all are invitation for what? These all are invitation for mucor. And drug of choice is LAMP, liposomal amphotericin B. Okay. Now coming to this, what should be the answer? An infant was admitted with cough and fever with moderate respiratory distress. The chest examination showed up generalized wheeze, and the infant was diagnosed as a case of bronchiolitis. Okay, it is being given. The bacterial cultures obviously will not yield any results. Why, guys? Because it is being done by a fungus. Sorry, it is being done by a virus. And what is the name of the virus? Respiratory syncytial virus. Okay, respiratory syncytial virus. So RSV. First of all, they can ask you that what is the family of the RSV? The family of the RSV is Paramyxovidae. Okay, it belongs to Paramyxovidae, and the answer is B, as you are told. Very good. And this is Paramyxovidae. The question which is there and can be asked: does it have H and N? What is H and N, guys? H is hemagglutinin, N is neuraminidase. Okay. Does this Paramyxovidae family member have H and N? No, both are absent. Parainfluenza, which is there in this paramyxo, they have H and N both. Mumps, they have both H and N. Measles, they only have H, they do not have N. That also needs to be remembered. And you are right, doctor, that palvizumab, this particular drug is being used for this, and the better treatment for bronchiolitis is ribavirin. Ribavirin. And another important hint, which might be there in the exam, is regarding the fusion proteins. Okay, so this particular, which one? RSV is having fusion proteins. Okay, along with that, the measles virus, that is also having a fusion protein. And because of that only, what they produce, multinucleated giant cells. What they produce, guys? Multinucleated giant cells. Okay, so all these important things you should know regarding the respiratory syncytial virus. And this syncytial means what? Synectia, multinucleated. Okay, this you already know, mumps, bilateral parotitis with genital swellings in the children, and in the adults it can be orchitis or oophorytis in the females. Does it lead to sterility? Yes, in 1 or 2% it can when bilateral orchitis is there. Pancreatitis is does. Along with that, it associates with aseptic meningitis. And what is the vaccine strain of mumps? Zaril Lin. What is the vaccine strain? Zaril Lin. That you need to know. Okay. Now, coming to this, a 35-year-old chronic smoker with chronic cough consulted a physician after he noticed a red colored sputum. Okay, scary situation. His sputum was negative for the acid fast bacilli. Okay, sputum culture yielded up red colored colonies on Neutrinaga. What is the likely organism? Yes, please. What is the answer in this particular one, guys? What should be the answer? Is it Pseudomonas? Is it Klebsiella? Is it Strepto? Or is it Serratia marsans? What is your answer? Yes, please. I'm waiting. Tell me your answer. And you have told A. Kartika have told C. Okay. And Anuj have told A. Why you have told Kartika C? Okay. Red currant jelly sputum. Okay, 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 okay. You are right. Kartika is smart. Hmm. Yes, please. And D fellow also came. Sean Parker. Serratia is red bacteria. Okay, okay. So what should be the answer, guys? The final answer to this question? Final answer to this question is A. Serratia marsans. Okay. Answer is this only, Kartika. Why? Because red colored colonies on Neutrinaga, that is the hint, which is a non-diffusible. This is a non-diffusible pigment which is being produced by this Serratia marsans. Okay. The Klebsiella does not produce that. Klebsiella does not produce any red colored colonies. So answer here it is C. Serratia marsans. Is it fine? Now it's okay, Kartika. And red colored sputum is due to pseudohemoptysis is being shown by this particular one. It shows up pseudohemoptysis and it is prodigiosin, which is the name of the pigment, prodigiosin, and it is a non-diffusible pigment which is being produced on the nutrient agar. So answer to this question is no doubt Serratia marsans, and you are right. In Klebsiella pneumoniae, there is a red currant jelly sputum. Along with that, what is there? Bulging fissure sign. Okay, bulging fissure sign, and the person is what? A chronic alcoholic. And it's a lobar pneumonia done by that. What is the other name of this Klebsiella pneumoniae? The other name of this is Fried or Friedlanders bacillus. Fried or Friedlanders bacillus. Is it fine, guys? Now coming to the next one. A 52-year-old HIV seropositive patient suspected of pulmonary TB admitted for evaluation. Sputum sample was submitted for the investigation. Which of the following does not apply to the MTB culture? The colonies on LG media are produced after 4 days. No way. No way. The answer is what? Directly, the answer is what, guys? I'm giving you the time. Tell me. What should be the answer? Tell. What should be the answer here? Yes, please. Yes, please. Waiting. What is the answer? Answer is A only, obviously. The colonies on LG media, they do not come in 4 days. It comes in how much? Or what? In fact, it is 6 to 8 weeks it takes to come. Okay. And what is LJ? Lowenstein Jensen. And in this, do we use agar? We don't use agar. We use hen egg for the solidification. And it is being Inspiciated. This culture media is inspiciated, not autoclaved. The colonies are typically rough, tough, and buff. They are wrinkled, difficult to remove, and they are yellowish brown. And on this LG media, they come in 6 to 8 weeks. They are eugonic or dysgonic. They are eugonic. Luxuriant growth is there, but it takes time to come this luxuriant growth. Is it fine, guys? So this is out there. Then the rapid blood culture methods. They are bactic, bacti alert. They give rapid results. Yes, they give a hint. Not exactly the results, but they definitely give a hint rapidly. Bactic and bacti alert. Concentration techniques, which are what? Petrov's, NALC, they are there. N-acetylcysteine, NaOH and HCl, Petrov's method. They yield better results, no doubt in that. They does. They change the thick sputum into thin sputum, which is the fluorescent dye used for Mycobacterium TB. So fluorescent dye used for this particular one is what, guys? Oramin, rhodamin. Okay, which one? Oramin, rhodamin. Along with that, we do here IGRA, interferon gamma release assay, IGRA. That is also termed as TB gold. In that, the sample of choice is not sputum, it is blood, because you want to see the action of interferon gamma. Okay, so that is also there in this particular one. Important is that gene expert RIF is rifampicin resistance, and which particular gene? RPOB gene that is involved up in this particular one. Bactec for TB can be done path. Yes, Bactec and Bacti alert they can be done for TB, and the culture is mainly the LJ. And other than LJ, if somebody asks you, Dorset egg media, Pitra Gnini, okay, Du Bois, these all are culture medias of TB. And in this bactec culture, which is a liquid culture methods, in that, what you use up? You use up Middlebrooks 7H11, which is a liquid media. This can be asked. Okay. So remember this particular point also regarding the MTB stuff. The vaccine you already know, BCG, Bacillus crematigorine. And this particular one is a strain of which one? Mycobacterium bovis, Danish 1331. Given by which route? Intradermal. Okay, yeah, very right. Sulla, Sorton, Du Bois. These all are culture medias of TB. They all are culture medias of TB. Okay, along with LJ. LJ is the most famous. Greenish color one, rough, tough, and buff colonies over that. Okay, so these all are the expected questions which can be there. And those gene expert and gene expert riff and all that, they give the results in how much time? 2 hours. CB NAT. If a person is having TB with HIV, then in that CB NAT is investigation of choice. Okay. Now come to this. Tell me the answer of this particular one. A 56-year-old chronic smoker presented with fever, chronic cough with rusty sputum from the past month. Chest x-ray shows dense infiltration in the lower lobe. The sputum growth on the blood agar shows alpha hemolytic colonies. Here is the hint, guys. Here is the hint, guys. Alpha hemolytic colonies. What is the likely pathogen in this particular case? So answer is, as Anuj have told perfectly right, the answer is C. The answer is C. Streptococcus pneumoniae produces a typical rusty sputum, first thing. Okay. In the lower lobe, it does the problem. Lower lobe infiltration, lobar pneumonia. Most common cause of lobar pneumonia is this pneumococcus. Then it is one of the common causes of CAP, community acquired ones. It is in the HIV also the most common cause of pneumonia. Right? So that is there. So overall, the most common cause is this. And what is the most common cause of atypical pneumonia, guys? Mycoplasma pneumoniae, also termed as walking pneumonia. And here the answer is what? Streptococcus pneumoniae. Alpha hemolytic colonies. It shows up alpha hemolytic colonies. It is a alpha hemolytic strepto. First thing. It shows up Karen coin appearance of the colonies on the blood agar and chocolate agar. Okay. And important is this particular thing is positive in this. What is that? Bio. What is bio? Bile solubility. Okay. What is this? Bile solubility. Inulin fermentation. Inulin fermentation and optochin sensitivity. and optogen sensitivity. These all things are observed in the case of pneumo. Okay, lanceolate. Lanceolate is what? Flame shape. Looks like a flame. So answer to this particular question is what, guys? Streptococcus pneumoniae. Important is it's a diplococci. It's a diplococci. This is in the pairs. This is in the pairs. Gram-positive cocci loves to be in the pairs. Okay, and it is positive for what? Biopositive. Which special typing is done? INI CET question. Okay, triple S typing. Triple S typing. And what is triple S typing? Specific soluble substance based typing. Specific soluble substance based typing. What is triple S? Specific soluble substance based typing. Okay, and according to that specific soluble substance based typing, it is divided into how many types, guys? 90 types. Now it is resistant to the, Anuj, you have remembered good, huh? Walking pneumonia, Eaton's agent, PPLO agar. Very right. And you must have written up the CAT also. Cold agglutination test associates with extrapulmonary features, this mycoplasma pneumoniae. And mycoplasma does not have a cell wall. So it is being stained by which special method? Dying's method of staining. So all these are important questions which definitely you can find in the exam, guys. Mycobacterium avium intracellular complex. There might be a question over it, guys. That is, which is the organism? That is Mycobacterium intracellular. What is the other name? The other name is Bates bacillus. Okay. Which other guy is there in this? MIP, Mycobacterium indicus prani. And this Mycobacterium indicus prani is used to make a which vaccine? MW vaccine, which is a leprosy vaccine. And it is a non-chromogen. It is a non-chromogen. Is it fine? Jumping joker, dye staining. Yes, you're right. Now coming to this, a young woman presented with an ulcer on her vulva, low-grade fever, rash is there on the face. The pus culture did not yield any bacterial growth. What is the recommended microscopic staining method in this particular case? What is your answer for this particular one? Yes, yes, very right, very right, very right. Yes, tell me, answer of this particular one. A young woman presented with an ulcer on her vulva, low-grade fever, rash on her face, pus culture, did not yield any bacterial growth. What is the recommended microscopic staining method in this particular case? Yes, please, tell me. The answer is B. Dark field microscopy, and very right. Dark field microscopy, they are talking about what, guys, here? Syphilis. This is a syphilitic stuff, and they are talking about the syphilis in this particular one, done by trypanosoma pallidum. Incubation period 9 to 90 days. And in the primary one, you have a hard chancre, genital ulcer, which is painless, along with painless lymphadenopathy. Inguinal one, rashes are observed in the secondary one, condyloma lata. Then it goes into latency, comes the tertiary one, gumas, and there is neurosyphilis and cardiovascular syphilis stuff later on. Very right. Corkscrew motility is there in this. The question which can come along with this dark field microscopy is which special staining is done, guys? Lividity and Fontana staining. Lividity and Fontana staining, which is which sort of staining? Silver impregnation methods. They are silver impregnation methods. I've told you the Lava company have made a phone. Which color phone? Silver color phone. And this is a special edition. This is spiral. Okay, this is spiral. This is also important. And investigation of choice, that is for the neurosyphilis is VDRL CSF. Otherwise, we have FTABS as the most sensitive, and most specific is PPI. Okay, trypanopallidum immobilization assay. And most commonly done is PPHA, heme agglutination assay. Indian ink preparation, cryptococcus, and you demonstrate the capsule in this particular negative staining. Okay, Jimsa. Jimsa stain is a common stain which can be used for anyone, and like this, Congo red is also a common stain which can be used. Very right. Benzathine penicillin and procaine penicillin and all. they are being used as a drug of choice in the case of syphilis. Important here, which can come extra, there's these names: Treponema pertuni, Treponema endemicum, okay, Treponema caretium. Pertuni leads to what, guys? Yaws. Endemicum leads to Beazle, that is endemic syphilis. Caritium leads to what? Pinta. And all these diseases or all these organisms, they are non-sexual transmission. Okay, they have a non-sexual transmission. The question can come regarding them is that which of the following have? That is Treponema pallidum. Okay, which of the following have? That is the Treponema pallidum. Okay, so they do not have the sexual transmission, and these diseases also do not have. So this might also come. Borrelia epidemic, louse-borne relapsing fever, Borrelia recurrentis, Lyme's disease, done by what? That is the Borrelia burgdorferi. Tick transmits that. And important is in the Lyme's disease, you have a particular ailment which can be asked. That is the heart blocks. Heart blocks is seen in erythema chronica migrans. That is, our red color lesion moves over the skin. In the case of leptospirosis, you have conjunctival suffusion, a favorite of examiner. Leptospira enterogens does that icterohemorrhagic fever. And which investigation? MAT. Which particular media? That is EMJH, Fletcher, Korthoff. Drug of choice, Doxy. Severe leptospirosis, penicillin. Okay. So these all are important things which you should know. In the leptospirosis, we also have the triple R. What is triple R? Rat, rice, and rain. Okay. It is present in the rat urine, happens to those who works in rainy fields, and happens to those which are like rainy fields, like rainy season and rice field workers. It enters the cracks in their foot, through that this particular individual enters. Okay, so these are regarding lepto, and lepto is having hooks. Lepto is having hooks, so they can give you a picture of all this. And dark field microscopy, which type of light is used? Reflected light. Reflected light is there in the dark field microscopy. Now coming to this, our district health authorities are planning to start investigating an outbreak of Marburg, and this district is where? This district is in Africa because India doesn't have Marburg infection. What is the recommended level of biosafety level for handling this particular specimen? Can you tell me this question? Already asked question of INICT. Tell me about this. What is the answer? Which biosafety level is there in handling this? Yes, please. Tell me. You told B, doctor. Hmm. BSL2 for Marburg. Kartika told D. Okay. Anybody else wants to try for this? B. Vikas told B. No, Vikas told D. Okay. Kartika told BSL4. Manisha told fourth. Utkarsh told B. Handling BSL2. Culture BSL3. Hmm. You are confused. Nirdhi Billah, you are confused. Answer is BSL4, guys. Marburg and Ebola is to be handled in the biosafety level 4, the highest level. They are hemorrhagic viruses. They does hemorrhagic fevers, and spontaneous deaths also being reported up. And Marburg also associates with bats. Okay, and recently, like now only currently in Africa, this is there. Marburg is going on and causing the like disease and deaths. So BSL4 is all about Marburg and Ebola. Already asked question that which other virus you can handle up in this? Ebola and Marburg. So answer is no doubt what? These filamentous ones, which are BSL4. Okay. BSL3. Guys, BSL3 is mostly for the TB, Mycobacterium TB. You should know. And this question came, XDR TB, MDR TB, all they are are to be handled where? In this BSL3. Okay. And the culture of SARS-CoV-2, which is the virus which does the COVID-19, is also being done in the BSL3. So vaccine preparation is there in this. Is it fine? BSL2. In this, the RT-PCR, in this, the RT-PCR of COVID-19, SARS-CoV-2 is being done. That is also being asked. That the RT-PCR is being done in which biosafety level of the COVID-19 virus? The answer is BSL-2. Okay. And BSL-2 organisms, they are like, you can have anthrax in this particular one. So they are being handled in the BSL-2. And BSL-1, the simple ones, simple like Bacillus thuringiensis and Aspergillus, these all are simple but doesn't do much of the problem. They are being handled in the BSL-1. Okay. So basically, to be remembered here is these particular points. Otherwise, the list is very long. No need to go into that particular list and all. Okay. So Ebola, Marburg, BSL-4, BSL-3, MTB, culture of this is being done. That is the SARS-CoV-2, BSL-2, RT-PCR of this, and it is for the others like anthrax and all. They can be handled easily up in this particular one. And BSL-1 is for the simple ones like Aspergillus, like Bacillus thuringiensis and all that. Okay. MRSA is not a very problem. It can be in the BSL-1. No problem. Because they don't go by this inhalation one. Na? So inhalation is a problem basically. For that, that's why we need the BSL-4 for the Marburg and Ebola. Yes, please. Now telling about this. A 3-week-old child presented to the pediatrician with meningitis. A presumptive diagnosis of the late onset perinatal meningitis is being made. The CSF culture was positive for the gram-positive bacilli. So this bacteria would be helpful in differentiating from the other bacterial agents. Yes, please. Answer to this question you tell. What is the answer to this particular question? Yes, please. Tell me. What is the answer of this particular question? Tell me. Probably the last question here. Yes, please. Tell me. Yeah, yeah, waiting. Tell. B, you told. Ability to produce the catalase. Okay. Any other? Yes, please. D. Anush told D. Kritika told D. Okay. Yes, please. Listeria meningitis. You told also. Okay. Okay. Akash told D. Answer is D, guys. Answer is motility at 25 degree is a unique property, which is of Listeria and very few others. So obviously, this will be the important one to differentiate. Okay. This will be the important one to differentiate. But, but the CSF culture was positive for the gram-positive bacilli. Okay. And this ability to produce the catalase, this is also unique in this particular one. Why? Because if you know that this is catalase positive, okay, and this particular property, a motility at 25 degrees Celsius, so this you can tell as a controversial question. Okay, why? Because this perinatal meningitis that is there in this particular one can be done by Streptococcus echinacea. Yes or no? And here we are having a gram-positive bacilli. So obviously, that bacilli stuff clearly differentiates up it from the that gram-positive cocci. The problem would have happened when then gram-positive he written up in the question, not bacilli, cocci, anything. Then the answer would have gone in the favor of what? Catalase positivity. Okay. Then the answer would have gone in the favor of catalase positivity because catalase negative is Streptococcus echinacea and catalase positive is this particular one. Okay. So this particular fact you should know for sure. But answer here, the unique property from the other bacterial agents, yes, the answer is motility at 25 degree will be there. Okay. So answer to this particular one is this. That is the fourth one. B can also be answer, but again, the INI CET questions are such only. Better answer will be D. Okay, better answer will be D. So, guys, an audio problem. Now we are ending up only, guys. Okay. Why is hemophilus? Who is telling hemophilus, Manisha? Where are you? Which hemophilus you are talking? So Answer is Listeria. This is Listeria monocytogenes, which does this meningitis. And you know that Listeria properties, that Listeria leads to granulomatosis infantiseptica. This particular disease, along with that, it can do meningitis even in adults. It does in children. Okay, even in children, granulomatosis infantiseptica is there in newborns, and in children and in adults it can do meningitis. In immunocompromised it can do what? It can do sepsis. And pregnant females, in the pregnant females the listeria leads to what? It leads to premature births, preterm births, and abortions. Preterm births and abortions, that is also associated with this particular listeria. Okay, and important is Anton test, Listeria culture in eyes of rabbit, catalase test, okay, and camp test. These all are positive in the Listeria. Now let me tell you the question. Let me tell you the question which will be coming in the exam. That it promotes what? It promotes actin polymerization for its intracellular movements. For its intracellular movements, this particular one is promoting a what? Actin polymerization. This already have come in the NEET PG twice. Definitely can come in this. Okay. And Nirday Billa have good knowledge about the listeria. He is telling up that it's a gram-positive cocoa bacillus, and very right he is that this should secrete what? Exo, but this is the gram-positive cocoa which also secretes of endotoxin, which also secretes of what? Endotoxin. Is it fine? So this is the unlike only gram-positive which secretes endo is listeria. That is to be remembered. Okay. Now certain other stuffs which can be asked up is that if somebody asks you what is a category A bioterrorist weapons, in the category A bioterrorist weapons, what comes, guys? Important one we'll talk about in this agents. Important ones like anthrax is there, which is being asked up. Okay, along with that, plague, botulism, smallpox, also termed as variola. Okay, smallpox, anthrax, botulism, they all, certain viral hemorrhagic fevers, Marburg, Ebola, and all, they come in that. Okay, so these all, they associate with what? Even tularemia, these all are category A bioterrorist ones. In the category B, if somebody asks you, in the category B, you need to remember only one name, that is Brucella. So Brucella is a category B, double L. And botulism is single L, so category A. So that is also there. Okay. So Brucella, a number of others are there. In this category B, this organism is also there, which is a favorite of every examiner, E. coli O157H7. Last time in NEET PG, they asked what is this H? H is flagella, O is somatic. Okay, H is flagella, O is somatic. And this leads to what in children? HUS. What is the, yeah, very right. Category C is Nipah, Hanta, and SARS-CoV. That is also there in the category C. Emerging ones. That is the category C. E. coli O157H7. That is in the category B, and it leads to this HUS. Culture media is being asked. SMAC, rainbow agar. That is there. SMAC and rainbow agar. In the recent NEET PG, what they have asked up regarding the gono, it ferments only glucose and it is being oxotyped based on the nutrition it's being classified. That is termed as oxotyped. Okay, so that is also important one. Then category C, as Billa have told, Nipah and Hanta along with SARS-CoV. Okay, so that is there. And this gonococci, it is having a media which is being asked, that is modified New York agar, and gono, recruit plasmids also. The gono recruits what, guys? Plasmids for resistance. So that's why it is becoming resistant to what? Third generation cephalosporins also. Okay, third generation cephalosporins also. Is it fine? Now, another favorite question of INI CT fellows is this: MSc. Medullary bodies, sclerotic bodies, copper penny bodies, copper penny appearance of these bodies is seen in which disease, guys? It is seen in chromoblastomycosis. Chromoblastomycosis. So this also you should know. Another important aspect which is there, which you should know, is regarding the dermatophytes. Trichophyton, microsporum, okay, epidermophyton. These particular names, they are there, na? They are asking regarding the shape of their macroconidia. The trichophyton macroconidia. How does it looks like, guys? Cylindrical. Okay. Another name for that is pencil. How to remember? Tricycle. And tricycle in the wheels is having pencil as a spoke. Okay. Microsporum. Microsporum. Microsporum is having SP, spindle shaped macroconidia. Epidermophyton, derma club, club shaped, or boat shaped. That is the macroconidia. Now, what about the microconidia here? The microconidia. In the epidermophyton, it is absent. In that derma club, which is an adult club, which fellows are not allowed, childrens are not allowed. Okay. Micro means itself less. So less microconidia. And numerous microconidia is a feature of what, guys? Trichophyton. Okay. Numerous features is a type of trichophyton. The best way is to remember this: tricycle, microsporum sp, spindle, epidermoderma club. That is, voting is done in this. And in this derma club, what is not allowed? These fellows are not allowed. Which one? Microconidia. Okay. So this is the way to remember the best one. This particular one regarding the dermatophytes. Definitely one question can come. Other one is Trichophyton rubrum. Okay, Trichophyton rubrum, and there is one dimorphic fungus which is termed as Telaro. Both starts with T. Telaromyces marnifi. They are the ones which associates with red pigment. They produce what? Red pigment. One of the fungus shows up this particular test positive, that is termed as hair perforation test. Okay, hair perforation test, also termed as wedge perforation test. And this hair perforation test or wedge perforation test is seen in mentigrophytes. Mentigrophytes, which is a causal agent of which particular disease? Kirion. Okay, which is a causal agent of what? Kirion. Nirdebile, the new name of Penicillium marnifi is Telaromyces marnifi. Okay, brush border conidial arrangement. Manisha, I've told it wonderfully well. Brush border conidial arrangement. That is there in this. So this mentigrophytes also does what? Kirion. A boggy swelling, a painful boggy swelling over the scalp. That is being done by this mentigrophytes. Is it fine, guys? Besides that, you should know all the names of the dimorphic one. HSBC. Please try to have account in which bank? HSBC, because it starts with a huge amount. H is histo. In the histoplasmosis, what you observe, guys? Sunflower-like appearance. Okay, to my Tamil students, to my Kannada students, and I suppose in Malayalam also, Surya Gandhi, है ना? That is tuberculate macroconidia. Surajmukhi जैसा tuberculate macroconidia is observed in histoplasmosis. This is to be remembered. And in this, you go for bone marrow biopsy. In that, what you observe? You observe narrow based budding of E cells. Then comes the sporotrichosis. Sporotrichosis is rose gardener's disease. And in this, as Manisha have told, asteroid bodies are seen. Okay, asteroid bodies are seen. This is having lymphocutaneous spread, and it is having lymphocutaneous spread, and it is having which type of pattern? Sporotrichoid pattern. Drug of choice for sporo is itraconazole. B is blasto. Blasto is North American disease. Okay, and it is having which type of E cell? Figure of 8. And how you remember? This B looks like a 8. Okay. C. C is coccidiido. We have just talked about arthroconadial, are spherules with endospores that is observed in this. San Joaquin Valley fever, desert rheumatism, paracoccidiados, Mickey Mouse appearance of the E cell, Mickey Mouse appearance of the E cell. And T is telaro, in which you have told up it is having brush border conidal arrangement, which looks like a Harry Potter broom, which looks like a Harry Potter broom. This you know that GMS, Gomori methamin silver, it stains of which color, guys? It stains of green, used for which particular fungus? Controversial fungus, Pneumocystis cerevisiae, which does pneumonia in the HIV positive at the count of less than 200, which is an atypical pneumonia, doesn't involve the lobes. And drug of choice is what? Cotrimoxazole. What is drug of choice? Cotrimoxazole. Okay, is it fine? So this is there, and in the Candida, this question already have come in the INICET. Candida krusei. This Candida krusei is intrinsically resistant to azoles, and that's why what you use for this lamp. This was asked. Candida auris, worldwide does infection. Candida albicans, Renault broad phenomena, and germ tube formation, that is Renault broad, and chlamydospore formation. That is it. Okay. So remember all these particular important points. Cryptococcus, most common cause of meningitis in HIV positive. Drug of choice, LAMP along with flu cytosine, Indian ink staining, and latex card agglutination is being done for that. And all others we already have discussed. Okay. So in very short, I've told you in 10 minutes, 15 minutes, the whole mycology. Okay. The whole mycology. And if we talk about some of the, in last 5 minutes, if we talk about some of the eggs, important eggs, so important is this is the egg which is having the polar filaments like this. This is the egg of what? This is the egg of H. nana. This is the egg of what, guys? H. nana. It is whose nana? Hymalophis nana, having the polar filaments. It's a non-bile stain. Drug of choice, Prazi. Okay. Besides this, the bile-stained egg, typical example, Ascaris. What about this? The dumbbell shape, having mucus plugs, Trichuris trichiura. Plano-convex, having tadpole-like larvae, that is Antrobes vermicularis, INICET question. Okay. Besides that, this particular one, having blastomeres, that is hookworm, ankylostoma duodenale, hookworm, ankylostoma duodenale. So these are the important ones. Ascaricytes, they can ask up. That is a bile stain one, roundworm. Okay. Other than that, important thing is that which particular worms in the helminthology leads to cancer? And the answer is which one leads to the cancer? One is Cystosoma hematobium, which is having which type of spine? Terminal spine. Which one others? Chlorichae sinensis, which leads to carcinoma bile duct or cholangiocarcinoma. And what these are, guys? These are trematodes. What they are? They are trematodes associated with what? Cancer. Which cancers? Cystosoma hematobium does carcinoma urinary bladder. Okay, and this does carcinoma bile duct or cholangiocarcinoma. Yes or no? Yes or no? Okay. This particular one, Rota was asked. Rotavirus. If somebody asks you regarding rotavirus, it is a double-stranded RNA virus. It is a double-stranded RNA virus, and this particular virus, which is double-stranded, is segmented. It is having segments, 11 segments. Segmented genome is there of this particular one. Okay, is it enveloped or non-enveloped? This is non-enveloped. This is non-enveloped. And what is the how does the rotavirus looks like on the electron microscopy? It looks like wheel with spoke appearance. Wheel with spoke appearance. Which particular virus looks like bullet, rabies? Okay, which looks like solar corona, club, petal like? That is COVID-19 virus, SARS-CoV-2. Okay, and already we know that this particular one, that COVID-19 virus, if somebody asks you, is a single stranded RNA virus. It is non segmented and it is enveloped. It is enveloped. Is it fine? So, in total, we have touched everything. In and around them, the questions will be coming up for sure. Okay. And what you need to do, you have to touch certain aspects in a slight bit more detail, some of the topics. Otherwise, the basics will remain this only everywhere. And along with that, definitely I've given you extra information also today. And I suppose this was your good revision session, and you must have got some extra points also in this particular discussion. Okay, yeah, rotavirus vaccine does the intussusception, not the rotavirus. Okay, rotavirus side effect vaccine is intussusception. Very right. Okay, and for this investigation of choice, if somebody asks, if you are telling only rotavirus antigen detection in the stool, rotavirus antigen detection in the stool. Okay, guys, see you. You were very active in the chat box, and with same activeness, give the exam and achieve, because in the INI CET nowadays, a lot of seats are there. So there's fairly a good chance to have a good rank there and a good seat also. So equally, you give the importance to this particular INI CET also, because of those peripheral aims, number of seats have increased markedly, and it could be very good for you that if you prepare it well and give it with your proper zeal. Only thing is which I want to tell up is believe in yourself. You can also enter the National Institute, because NIH swebbing is done for what? Enterobius vermicularis. So enter the National Institute. That is there. Okay, Kartika. Okay, Manisha. Okay, that is Dr. Nirdhi Billa. Thank you. Okay. See you. And if you have any doubt and all, you can ask me on my Instagram, on the DocTutorials also, and in the YouTube also you can ask of me. Okay? Any doubt and all, these can be asked. So thank you so much. Take care. Bye bye. See you.